Welcome to the Research Training for Patient and Public Involvement members within the Cicely Saunders Institute. Once the researchers have identified the topic that they're going to be researching, they need to create a research design. And this includes clarifying those research questions, maybe creating some sub-questions based on the aim that they have. And then they need to design the research project. And in designing the research project, this often looks at the methodology that might be used or the methods in order to create the project and to find an answer to that research question. Quantitative research enables a systematic, rigorous, and empirical investigation. It also uses tools such as outcome measures or other quantitative assessments. Qualitative research explores in depth a problem or a phenomenon to gain a deeper understanding and a greater insight into a topic. This might include interviews, focus groups, observations, case studies, audio or visual recordings, and also documents. Once a research proposal has been created and a plan has been designed, the researcher will need to seek ethical approval from an ethics committee. And the job of an ethics committee is to make sure that the research carried out respects the dignity, rights, safety, and well-being of the people who take part. Ethics committee members also include researchers and healthcare professionals, as well as members of the public.
One of the biggest projects I've been involved with for the last 3.5 years is with the Cicely Saunders Institute, and it's looking at how we can improve end-of-life care for terminally ill patients in their own home, because that was where we actually suffered very badly with very poor support. And in particular, we're looking at the out-of-hours provision of care, and that's really been the core of this exercise, to try and eke out those particular items. We've used the Delphi process. The Delphi process started off with a very, very wide number of issues which had actually been gleaned from past research projects. And the process invites a number of parties, people like myself, healthcare professionals, to actually vote for which of those items they think are the most important. And through that, you actually get some of the issues taken away, and you can go through this 2 or 3 times to make sure that what you end up with are very much the most important items. We also were able to make recommendations that perhaps some of the terminology, some of the language could be made rather more easy for people to understand. One of the phrases which is used a lot by professionals is anticipatory medicines. The public may not know what an anticipatory medicine is, but actually you can use a simpler language to make sure this is understood by all.
We work very closely with our PPI group on that. So we started with looking at what questions we should ask in the first round. So you keep asking, you do a round, you narrow it down, you do another round, you keep going until you reach a consensus. What, as far as our PPI group were concerned, are the most important factors in out-of-hours care? We'd obviously looked at the literature as well, and we had looked at all the criteria involved in quality of services, but we wanted to know in real life terms, what are the most important things? And we came up with 68 things. We used those in our first round. We got our results for the first round. Some of them were a bit puzzling. For example, anticipatory medicines, because people don't know what that means, what an anticipatory medicine is. So you need to ask that in plain English. So we changed our questions, some of them, for round 2, and sure enough, the results came back differently. So without them, I don't think we could have managed to get it right.
So as part of the study that I work on, we've been working with the Young People's Advisory Group at one of our local hospitals, and the group's made up of children who have different conditions, their siblings, children of healthcare professionals, and children that want to go into medical or research professions. And we've been working with them throughout the study to design our patient information leaflets to make sure that they're suitable for children of different ages and abilities. And we've also been working with them to design a script for a video that will actually tell children a little bit more about our research in a bit more of a child-friendly way than just having a written information sheet. It's been really helpful because it makes sure that actually these sheets are usable and useful for the children taking part in our research.
When we were undertaking the RESPOND study, that was an NIHR funded study, we were looking at the best way to communicate positive results with families following a newborn screening result. And we consulted with our PPI group in the first instance to find out how we should write our participant information sheets to make sure that they made sense, but also answered all the questions that potential participants might want to know the answers to in order to be involved in our research. Once the project was established, we spoke to our PPI group about the sites that we should actually choose to be our study sites in the project, and they helped us to decide which would be most appropriate, and they were the study sites that we actually took forward to the main part of the study. We also spoke to them about the best ways to disseminate our findings so we could make sure that the right people could read about our findings, and any families who were going through the same situation would be able to access those findings and make use of them.
If you have any further questions about how research works or how you can get involved in research, please feel free to contact csi.ppi@kcl.ac.uk.